Hi there, today we'll discuss about lithium, its uses, side effects, warnings, dosage instructions, etc. So lithium is a type of medicine known as a mood stabilizer. It stabilizes the mood. It's used to treat mood disorders such as mania or feeling highly excited, overactive, or distracted. Hypomania, similar to mania but less severe, regular periods of depression where treatment with other medicines has not worked. Then bipolar disorder, where your mood changes between feeling very high, that is maniac, and very low, that is depression. Lithium can also help reduce aggressive or self harming behavior. It comes as regular tablets or slow release tablets, that is lithium carbonate. It also comes as liquid that you swallow, that is lithium citrate. Your doctor will carry out regular blood tests to check how much lithium is in your blood. The results will be recorded in your lithium record book. This is necessary as lithium can cause toxicity very easily. Now let's see some of the warnings that come along with this. Some medicines can interact with lithium and cause a serious condition called serotonin syndrome. It is not known whether lithium will harm an unborn baby. Tell your doctor if you are pregnant or planning to become pregnant. Lithium is not approved for use by anyone younger than 7 years old. Now let's see the dosage. Usual adult dose for mania. For acute control, usual dose is 1800 mg per day. In extended release formulations, it is 900 mg orally in the morning and at night time. For regular release formulations, 600 mg orally 3 times a day in the morning, afternoon, and nighttime. For long-term control, the maintenance dose is 900 to 1200 mg per day. In extended release formulations, 600 mg orally in the morning and at nighttime. In regular release formulations, 300 mg orally 3 to 4 times a day. Now, usual adult dose for bipolar disorder, acute control, usual dose 1800 mg per day, extended release formulations 900 mg orally in the morning and at night time. Regular release formulations 600 mg orally 3 times a day in the morning, afternoon, and night time. For long-term control, maintenance dose is 900 to 1200 mg per day. Extended release formulations 600 mg orally in the morning and at night time. Regular release formulations 300 mg orally 3 to 4 times a day. The following are the side effects. Get emergency medical help if you have signs of an allergic reaction to the lithium, such as hives, difficulty breathing, swelling of your face, lips, tongue, or throat. Too much lithium in your body can cause death. Lithium toxicity can occur if you take only slightly more than a recommended dose. Stop using this medicine and call your doctor right away if you have symptoms of lithium toxicity such as muscle weakness, twitching, drowsiness, feeling lightheaded, mood changes, blurred vision, ringing in your ears, irregular heartbeats, confusion, slurred speech, clumsiness, trouble breathing, or seizures. Common side effects include dizziness, drowsiness, tremors in your hands, trouble walking, dry mouth, increased thirst or urination, nausea, vomiting, loss of appetite, rash, or blurred vision.